Sorry, baby. Hey guys, welcome back to my channel. I'm sorry I've been a little missing lately. I had a really bad eye infection. Well, I don't know if it's called an eye infection. It's a corneal ulcer. It's I don't know if it's from riding in the sand and the sand coming up. We were riding golf carts at one of our favorite campgrounds, and the sand coming up and getting in my eyes, or just chronic contact use or whatever, but it caused a really bad corneal ulcer, and had some trouble healing from it, and affected my vision. And the people at work called me Cyclops because it was a big red inflamed. It swelled almost shut the first night that it was really bothering me, and it was really bad. I had to do eye drops every hour for a couple of days, and they switched me to steroidal eye drops, and then decreased the antibiotic eye drops to every 2 hours. And yeah, anyways, it's starting to get better now. I went back to the eye doctor again today, and it is improving vastly, and it's not scarring or anything, so it's getting much better. So I'm finally getting better. It's looking up, and I actually made this video, started making this video in my phone, kaputted on me, and it only made it through a little bit of it. So I'm gonna try it again. So what I'm doing now is this October I celebrated 5 years cancer free. 5 years since diagnosis. I was diagnosed October 3rd, 2016 with breast cancer. I'm so blessed to be celebrating 5 years cancer free. October 25th is 5 years that I was cancer free. I had a double mastectomy 5 years ago, October 25th, and I'm so blessed to be cancer free. I'm actually an oncology nurse. I've been an oncology nurse for many years. I've been a nurse for 29 and a half years this month, and I feel like I was at an advantage because I was an oncology nurse. I mean, I didn't know a lot about mastectomy, or, you know, I knew a lot about stages of cancer and what chemo would do and all that stuff, but it's a whole lot different when you're the patient. So I've actually thought about writing a book about it and stuff, but, you know, being a patient, being a nurse and a patient at the same time, and, you know, they say nurses are the worst patients, but I really try to be a good patient. So I actually was a patient at the same place I'm a nurse at the same facility that I'm a nurse at, and the patients love seeing me there. So that was pretty interesting. So I hope I never have to do it again, but I'm trying to make the best of it. So in September of 2016, I was extremely fit. I was training for a half marathon. I was slim, like 60 pounds thinner than I am now. Just, you know, tone cut arms, running, you know, 30 miles a week, 35 miles a week. And I was probably the best shape of my life. And I was very confident in my skin, feeling good. And then on my husband's birthday, on his 50th birthday, you know how it is, birthday sex, he ran his hand across my breast, and he just turned pale as a ghost. And I said, "Babe, what's wrong?" And he said, "You have a lump, babe." And he just was pale as a ghost. And I said, "Are you sure?" He goes, "Yeah." And I felt it, to be sure, and I think I wore myself out, that spot out. It was like right to the right of the center, you know, right to the right of the cleavage, right there. And it was like the size of a overgrown blueberry, like a blueberry on steroids. It was definitely like a hard lump. I mean, it was definitely there. It didn't go away, no matter what, you know, no matter how many times I touched it, didn't go away. So that was about 7.5 weeks after a normal mammogram. So I'm like, I'm sure it's nothing. But I'm like, this is really weird. Well, that was on a Friday night. So on Monday morning, I knocked on my oncologist's door, the same oncologist I've worked for 16 years, and I knocked on his door and I said, I had this lump, I need to get checked out. He said, yeah. He said, me and my nurse practitioner will peek at you. And so they put me in a room and they examined me and said, I don't think it's anything, but with your history, he said, let's go ahead and get an ultrasound. Well, 7 years before, I had, at 38 years old, I had a little lump. So I was 45 years old then. At 38 years old, I had a lump that sent me to my first mammogram. And it showed clusters of microcalcifications, which are just like little clusters of little spots that they look at. And when they're in clusters like that, sometimes it can be cancer. So the radiologist said, let's go ahead and get those biopsied. So I saw the surgeon, and the surgeon said, yeah, let's go ahead and get this biopsied. So they put me to sleep, put me under mammography first, and identified them, and put metal rods in there, and identified where they were. There were several different areas, but I think they biopsied 2 spots that they could get to. And then they put you to sleep, and the surgeon scoops them out, and then they take pictures after you wake up with mammography to make sure that they got the correct spots. Well, the results of that biopsy showed I had atypical hyperplasia, which is, just irregular cells. And having these irregular cells, they're a faster growing clumped together cells, and that it sort of kind of is like a precancerous thing, but not necessarily, but it can give you a higher chance of developing breast cancer. So they put me on this medication called tamoxifen, and anybody that's been around anybody with breast cancer knows about tamoxifen. It lowers your, it knocks down the estrogen levels to make you less prone to getting breast cancer. Well, they put me on that. I was supposed to be on it for 5 years. I took it for 18 months, and I got a blood clot from here to here. And they told me I had to go off of it. If anybody ever wonders what that little tattoo is, sorry, I made my bed. I just stripped my sheets. So, it's a little tiny breast cancer tattoo. Oh gosh, I'm going to knock over my tripod. A little tiny breast cancer tattoo. I actually have one on my finger right now too, on my nails, but it's a little breast cancer tattoo. So, anyways, I was on that until I got my blood clot, and then I was just doing MRIs at 6 months and mammograms at 6 months. So, anyways, I did that until I got this new lump. So immediately, that was on Monday that I went and saw my oncologist, and on Thursday I went and had the ultrasound. And here's the ultrasound tech doing the ultrasound, and she said, I'll be right back, let me go get the doctor. And I'm like, uh-oh. Whoops. And the doctor walks in, and I was familiar. She's the one that told me I had the atypical hyperplasia. So she said, Jeanie, we need to go ahead and do a mammogram. And she's also the same one that had done my mammogram 7.5 weeks before. And they did it, and they blew it up, blew it up. And they saw this spot. But not only did I have the one spot where the lump was, but I also had spots like buckshot throughout this breast. So I had this one main lump the size of an overgrown blueberry, and then I had buckshot throughout the breast. And I told her, I said, Dr. Yancey, please be straight up with me. I said, I'm an oncology nurse, who I work for. And I said, do you think I have cancer? And she said, yes. She said, I think if this is cancer, she said, then this is definitely cancer. She said, I would do a Rosenberg special. Well, he's our local reconstructive surgeon, and what we call a Rosenberg special is where they take off both breasts and reconstruct you. Well, that night at home, and I missed the call, which is probably good, I heard it on a voicemail the next morning, was my oncologist calling and saying, you know, don't worry, Jeanie, we're going to take really good care of you. I heard you had a pretty rough ultrasound and mammogram today, but don't you worry, we're going to take really good care of you. Don't worry about a thing. We got you, okay? You're part of our team. We're going to take really good care of you. And I thought to myself, well, shit. Now I know I have cancer, which, excuse my French, but, you know, when the doctor calls you, you know, that the radiologist said, you know, I really think you have cancer, and then your oncologist calls you and said, we're going to take really good care of you. Okay, I kind of knew I had cancer. So the next week I had a ultrasound. Now in between this I saw the surgeon and all that kind of stuff. I had to decide if I wanted to be put to sleep again or if they could just do it like a punch biopsy. I had the biopsy the next week where they just took me to, they did a stereotech biopsy where they, I'm awake and they just numb it a little bit and do an ultrasound and get the spots with a needle and just go back and forth into the areas. And it looks like a urine cup, and then they punch out several different areas of the tumors, and then they send it off for biopsy, and then you put a big ice pack on your chest, and then they do mammography to make sure that they got all the areas that they wanted to get, make sure they biopsied all the right areas. Well, that was on Wednesday. On Monday morning at work, on duty at the cancer center, I wrote down stuff so I didn't forget anything. Well, on Monday when I came to work, one of the nurse practitioners, I saw her in the hallway where I work, and I said, Tracy, I said, have you heard anything yet? I said, I haven't heard anything from my biopsy. And she got tears in her eyes right away and stopped walking, and I said, are you okay? She goes, yeah, but Jeanie, I'm so sorry. She said, you have cancer. I said, Tracy, it's okay. And I hugged her to make sure she was okay. She was having such a hard time with it. And I'm like, it's okay, it's okay. So I'm back to work doing everything I had to do. This was like 8:30 in the morning. At like 10 o'clock, my surgeon's office called, and it was the nurse from the surgeon's office. And she said, it was Becky, and Becky says, Jeanie, you need to come see us this afternoon because we need to make an appointment for you to see the surgeon this afternoon. And I said, this afternoon? And she said, yeah, we need to go ahead and get you on the books to discuss mastectomy options. I said, mastectomy options? She said, well, you don't really have much choice. It's either a single or a double. I'm like, Becky, I haven't even told my husband that I have cancer yet. She goes, baby, it's time. It's time, girl. And I'm like, well, I kind of wanted to tell him first. And she goes, it's time. So I told him to pick me up. It's in the same parking lot. So I told him to be there at 3. So I told him in the truck before we had to be at the surgeon's office at 3:30. So anyway, so we told my family that afternoon, the kids, we have 3 kids together, you know, between the 2 of us, we have 3 kids. So we told them. So anyways, we let them know. Anyways, we 3 weeks later, after I found out I had breast cancer, which was on October 25th, I had the double mastectomy. Less than a week later, on October 31st, Halloween, I went and came home with, 2 drains. I had a mastectomy outpatient. Showed up at 6:30 in the morning to have my mastectomy and went home at 9:30 at night with 2 drains in, one here and one here. And October 31st, I went to see the doctor and I got one of the drains removed, and I saw my oncologist that day, and he told me my mammoth print results is either high risk for recurrence or low risk for recurrence. Low risk means you don't have to take chemotherapy. High risk means you do. Well, he said, I'm sorry, Jeanie. He said, you're high risk for recurrence. You do have to take chemo. And I was really, really, really disappointed. And I remember my mom telling me, Jeanie, if God wants you to take chemo, you're going to have to take chemo. And I'm like, I'm sorry, Mom. I'm just disappointed. I mean, you know, I know he's going to walk me through everything, but I'm just disappointed. I'm just disappointed I really didn't want to have to take chemo. So on November 17th, I took my first chemo, and I was sitting beside my patients and taking chemo. So the only days I took off as a nurse were the days I took chemo. So my patients were so supportive and were so wonderful. I kind of made myself into a material girl the days that I took chemo. I dressed up. I put my material boobies on because I had no breasts. I mean, I had nothing. I had no breasts. And after my very first day, my very first chemo, I lost my hair 13 days later. So I had no hair, zero. I had no hair under my arms, no hair wherever you can imagine, and no hair on my head. So I wore little head covers, but on my days of treatment, I wore a wig. So I could be whatever color I wanted to be, and I just made myself feel pretty because I wanted to feel good on the days I took chemo, and I wanted to make a good impression, you know. I knew where a lot of people were watching me. I knew my patients were watching me, and I hope that that's the only time I ever have to do it, and I really wanted to, you know, act like it was the only time I was going to have to do it. So I wanted to make the best of the situation. So I did very well with my treatments. The Neulasta, the thing that it's like a delivery device. It looks like a little mouse, like a computer mouse, but it's smaller. They put it on either on your arm back here, or they put it on your stomach down here on your side. They put it on you too. It's medication to help increase your white blood cell count to keep you from getting infection. That medication's the devil. It's awful. And it's not that way to everybody. Me being a nurse, I know that it doesn't treat everybody that way, but it made me hurt from the top of my head to the bottom of my feet. I took the Claritin and the Aleve that they tell you to take to keep from getting some of the side effects that you can get from it, but golly. I always took my chemo on Thursday, usually Thursday afternoon, and by Saturday evening I better start heading towards the bed, and I stayed there for a day or two, but it was mean. But yeah, I recall coming back from Thanksgiving. I told you I got my first chemo on November 17th. My birthday was November 12th, and we went. My husband was so sweet. He took me to a bed and breakfast for my birthday, which, you know, I'd just been diagnosed with cancer and all this kind of stuff. And he was so sweet. He took me to a bed and breakfast in St. Augustine, which is one of my favorite towns. And it's just a very historic town. And I just love that town. Went to a cute little historic bed and breakfast right on St. George Street. I think it was the St. George Inn. And we went out Friday night and a little salad. And I always love pumpkin beer. So they had pumpkin beer, and oh my gosh, I think I had 2 of those, maybe 3 of those, and I mean, this was over several hours, so it was so good. I knew something was wrong because on the way back from the restaurant, I was throwing up in the planters on St. George. St. George is a very historic street. We were going to go somewhere else, and I was throwing up in the planters on the way back. I'm like, something's wrong. This is not me. Something's wrong. So we were planning on going someplace else for a bigger dinner. Nope. So anyways, my daughter ended up going to get my anti-nausea medications that the doctor had already called in for me for chemo, and getting crackers, and oh gosh. So the birthday kickoff didn't go great. So But anyways, we were coming back from a camping trip on Thanksgiving, and my hair did like this on my hair, and a big, just lots of hair came out, and I was like, oh, in the truck right on the way home, and I was like, okay, already, because my scalp was a little sore, and I'm like, okay. And so by like Wednesday, it was really starting to look pretty thin, and so I went ahead and made an appointment with my hairdresser on Friday, and she was wonderful, and she started shaving it, and she said, okay, I'm going to try to leave it like 1 inch long so you can have a little bit, and then I'll take it on down if you need me to. Well, she said, Jeanie, you have too many bald spots. So it was gone. It went from having this length to gone. So I was really embarrassed. I didn't want anybody to feel uncomfortable when I wore my hair. I wore those little, they're like a tube, I guess, and then you can tuck them under like a ponytail, or you can just wear them like a little, like a little flat back here, whatever. And I wore those at first, and I just made a comment to my coworker that I was kind of embarrassed. I didn't want to show anybody my head, and they're like, do you know where you work? And I'm like, yeah, I do, but I don't want anybody to feel uncomfortable. I am a nurse here, not just a patient. And they're like, they're gonna love it. And I'm like, yeah, but I just don't want to make anybody feel uncomfortable. Well, the first time I did it, people were they loved it. They wanted to kiss my head. They wanted to rub my head. And God, the people that were so sweet and just opened up to me. And I remember fatigue was my absolute biggest thing that got me, was fatigue. And I remember a day when I just had nothing left, just was absolutely exhausted, but probably between cycle 2 and 3. And I had a lady, and I smiled and said, did she need anything? Because they were so good to me during chemo. They're, try to give me a little bit lighter schedule and stuff. And I said, do you need anything? She said, I just want to tell you, Jeanie, she said, you have been the biggest blessing to me. She said, I didn't want to come today, and then I thought about you. She said, how you're here with no hair, no boobies, because I couldn't even fake that I had no boobies, because it took me forever to heal, so I couldn't wear a bra. Never could wear a bra until I got my breast redone. It just hurt. My chest hurt all the time. Just nothing would stay, and I have some great stories about that too. But she said, you make me want to try harder. You make me not want to give up. She said, you're just such a blessing. She said, you encourage me just by your nature. And it's so humbling. I never want to take away that I had cancer, because it has been such a blessing. It brought me closer to the Lord. People can say what they want to say, but I've always been close to the Lord. I just have since I was a little girl. I always was. I don't know if y'all know what a PK is, but I'm a PK. I was a preacher's kid, and my father was not a good man, and he's gone now. But that didn't steer me away from God, which is good. And many things that happened to me as a child should have, but it didn't. So I'm very glad of that. But I was so blessed in so many ways. I ran out of FMLA, ran out of PTO, and my practice manager kept saying to me, you need to go ahead and, my chemo was over. She said, you need to go ahead and put your reconstructive surgery on the books. And I said, I don't want to right now. I said, I just cannot do that. And she said, what do you mean you can't do that? I said, I don't want to put my family in a monetary bind because I want to have breasts put back on. I just can't see that. So when you have reconstructive surgery, the kind that I had, you can't drive for 8 weeks because they take your stomach fat and bring it up and make mounds onto your chest. And they also take an artery from your stomach and bring it up, microsurgery up underneath, and attach it up here so these have blood flow. And that's what keeps them alive and warm and soft. And So you can't drive for 8 weeks because if it gets damaged, if that artery gets damaged, they don't have blood flow anymore and the tissue dies. And so you can't drive for 8 weeks. Therefore, I live an hour away from where I work. I said, I can't do that. And she said, please just schedule it. And I'm like, okay, I'll do that. I had no idea what it was about, but she was just adamant about it. So I had already seen this surgeon before I even had my mastectomy, because for aesthetics, he wanted me to see him before I even had my surgery, for the regular general surgeon that did the mastectomy. So I did that, and she said, okay, I went ahead and put it on the books, but it's just tentatively. She said, I want to tell you now. She said, sorry, my dog she bites her toenails all the time, my Daisy. If y'all hear her crunching over here. She said, I just want to let you know. She said, many of your coworkers have come to me and they want to donate PTO to you, paid time off. And I said, I don't understand. I said, I didn't know we could do that. She said, yes. She said, many, and I mean most of the people that work here they know what you're going through. They see you every day and they see you fighting hard, and they want to donate time to you so you can have your surgery. They don't want you to have to wait. They don't want you to have to be without. They want to do this for you. I swear I cried like a baby. Anytime anybody said anything about it for months, I cried like a baby, because to me it was so humbling that people would give to me out of their hard-earned money, and just from their heart, so I could have something that made me feel whole again. I mean, to me that was just such a selfless thing, and it just blew me away. I guess I wasn't smart enough my husband and I had already discussed it. We didn't need long-term disability. That's what savings accounts were for. For some reason, I didn't have short-term disability. Well, I learned my lesson with that one. I have short and long-term disability now, but I didn't have either one of those. I guess I didn't know that I needed either one of those. Well, I have them now, but I didn't then. And I couldn't have taken either one of them then either, because I had my own insurance. And I needed my insurance to keep up with my medical bills, because chemo is expensive. Surgeries are expensive. My mastectomy was like $96,000. And it was outpatient. For a double mastectomy, it was outpatient. My surgeon requested, he said, I want you to go home that night. He said, y'all have everything you need to take care of you at home, and you have less chance of getting an infection at home. Okay. Oh, I was a little nervous, because I'm the patient. I might be the nurse, but I'm the patient, so I can't do anything to help myself. Yeah, my husband was wonderful. So I'm absolutely humbled. So anyways, this is getting really long, but I was so blessed. I'm so grateful to my husband and daughter for taking such good care of me. Really didn't. My father-in-law was great. Like, he brought us some supplies and stuff, but other than that, my daughter and my husband, I really didn't have anybody else that took care of me or checked on me or anything else like that. I was really hurt by my mom. After my mastectomy, my mom hurt me really bad. She pulled away from me, and she wouldn't, she quit calling me, and she quit reaching out to me. And I didn't know what was wrong, and I finally reached out to her, and I said, Mom, what's going on? She said, I had to pull away, and I said, what do you mean? She said, Jeanie, I thought you were going to die. She said, and I knew it was going to hurt me, so I had to pull away from you. I said, okay. I said, that's what I needed to know. So, all through chemo, I did chemo without my mama there. And I had to forgive her, because in February, the last of February, she was diagnosed with a terminal cancer and made it 28 days before she passed away. And I was right there by her side. I was with her when she died. That sucked. That really sucked, but I'm glad I was able to be there for her, with her when she passed, but it really sucked. But I'm glad I was able to be there with her. So anyways, I hope my story, if anybody ever needs anything, any questions about breast cancer, any questions, any support you need, whatever, any questions about reconstructive, I had what's called DIEP, deep inferior epigastric, deep inferior epigastric perforator flap reconstructive surgery. I had a double mastectomy, complete double mastectomy. Then I had Taxotere, Cytoxan, Neulasta for 4 cycles. Then I had the DIEP flap reconstruction. I had 5, my brain doesn't work, my mouth is whatever, it doesn't work as well as it used to. I had 5 revisions, so most recently, and I finally finished, I had nipple, I had tattoos. I had Paramedical nipple tattoos in June and September, and I love the way it turned out. They look like real nipples, and I love them. So I'm, other than my 60-pound weight gain, I am back to normal, and I feel like a woman again. So, but if y'all ever need anything, any questions about anything, and if me sharing my story can encourage somebody to go get a mammogram, or feel yourself, or have your husband feel you, or whatever, y'all go around feeling each other if you need to be, so seriously, if y'all can use my story to help each other, and if you need anything, pass my story along if you need to, and if you just want to, share my story along, you can do that too. But God bless you guys, and I'll get back out there doing more regular videos now. It's been a few minutes since I put a video out, but love you guys, and we'll talk to you soon.